Talk about next is the sleeve gastrectomy. Sleeve gastrectomy, if it was compared to the normal anatomy, we'll appreciate that there's no difference in the small bowel itself. And in the sleeve gastrectomy, the stomach is made in a shape of a sleeve where the lateral 75% of the stomach is removed. Removing 75% of the stomach is done in a scaled fashion. This is in contrast to the gastric bypass and the lap band that we'll talk about a little later. What that means is that by removing a 75% of the stomach in a scaled fashion, and the 75% is actually removed from the patient's body, what we're left with is a 25% of the stomach that functions physiologically very similar to normal anatomy in a much smaller scale. So instead of Big Mac fries and a Coke, let's say we're going to be able to have a Happy Meal, small fries, and a lemonade, because carbonated drinks are not good for anyone. As the food sits in the stomach, just like normal anatomy, there are certain chemicals that are added from wall of the stomach into the lumen of the stomach. Food is broken down, and when the food is broken down and biochemically and physically is in the proper shape and form, the pyloric valve opens up. That allows for the food to travel down the entire length of the small bowel. As the food travels down the entire length of the small bowel, we have the juices from liver and the pancreas that are added, and as with normal anatomy, wherever the food is mixed with the juices from liver and the pancreas, carbohydrate, fat, and the protein are absorbed. The very first segment of the small bowel, just after the pyloric valve and before the juices come in, carbohydrate gets absorbed. Again, just a reminder that this is oversimplification of the facts.